Today we're going to discuss ADHD. What is ADHD? The causes, solutions, foods that help, supplements, mental practices, aromatherapy, and pressure points. What exactly is ADHD? It's a condition that affects people's behavior. Some people with ADHD can experience restlessness, impulsive behavior, or problems concentrating. Studies show that certain areas of the brain allow us to solve problems, plan ahead, and understand others' actions or control our impulses are often affected. The main cause of ADHD is also hand in hand with an underlying condition that can be from nutrient deficiency and heavy metals, as well as food additives. Food additives cover a wide range of chemicals. 5,000 additives are used in the U.S. It is now estimated that each person in the U.S. is consuming 8 to 10 pounds of food additives each year. The 1985 per capita daily consumption of food additives is approximately 13 to 15 grams. The total annual consumption of food colors alone is approximately 100 million pounds for the entire population. There also seems to be a relationship between sucrose consumption and artificial food dyes. Also, hypoglycemia would obviously promote hyperactivity via increasing adrenaline secretion. Refined carbohydrate consumption appears to be the major factor in promoting reactive hyperglycemia. That is a result of a quick elevation in blood sugar for 1 to 2 hours, followed by a severe drop in blood sugar levels. So to avoid this and to avoid onset symptoms of ADHD, it's important to eat a healthy snack every 2 hours. Healthy snacks include fruits, nuts, beans, and high-protein snacks, even like a natural beef jerky, a hard-boiled egg, anything low in carbs and sugars. Now let's factor in nutrient deficiency. Virtually any nutrient deficiency can result in impaired brain function. Iron deficiency is the most common nutrient deficiency in American children, as well as adults. Other nutrients, especially important to proper brain function and nervous system function, include thiamine, niacin, vitamin B6, vitamin B12, copper, iodine, iron, magnesium, manganese, potassium, and zinc. A deficiency of any of these essential nutrients will result in impaired brain and nervous system function. Often people are treated with the drug called Ritalin. It's a form of methamphetamine that is so nearly identical to cocaine that the two are used interchangeably in medical research. And like cocaine, the benefits of Ritalin are a mirage. The importance of this video is to highlight the nutrients depleted while taking these pharmaceuticals. Magnesium, potassium, and zinc levels may decrease. People with symptoms of attention deficit often have an undiagnosed underlying health problem that is the true cause. It would be wise to have allergies checked, food allergies specifically, nutritional deficiencies, even yeast infection. Also have your doctor check your thyroid function and take a blood test for anemia. I am not a medical doctor, and anything that you are taking from this conversation, I advise you to consult your medical doctor before adding or subtracting anything from your regimen. Some essential oils that can be useful when treating ADHD include vetiver, lavender, orange oil, chamomile and ylang ylang, sandalwood, frankincense, and peppermint. Oils can be applied in several ways. They can be applied diluted to the skin, such as through massage, or they can be diffused to become a fragrance, which is aromatherapy. If you're putting essential oil onto your skin, be sure to dilute it with a carrier oil, such as sweet almond oil or vegetable oil. Do not take essential oils internally, many are toxic. Now we are going to discuss some acupressure points that help with ADHD. The first one is a yin tang point, which is right in between your eyebrows. So you're going to find this acupressure point using the medial end of the two eyebrows at the tip in between your nose, if that makes sense. Use your index finger or your thumb to apply pressure on the center point between the two eyebrows. The second point is called CV12, also known as Ren 12, Zhang Wang. To find this point, it's going to be between your belly button and the point below your breastbone. You find it in the midline of the abdomen. The third point is on the outer edge of the elbow crease. So you're going to bend your arm and press your thumb into the tiny indentation that you're going to find located right on top at the outer edge of the elbow crease, right above your elbow. And I'll throw in one more. There's an acupressure point called the liver point. And let's say you're looking at your left foot. It's going to be the point in between your big toe and the toe next to it. Okay, so the big toe and the second toe, where they meet, you want to push on that one. Now, I could go into depth with each point and the benefits that they have, but I don't want to bore you with all that. I will just leave you with the knowledge that acupressure works by placing pressure on specific points on the body to release ki, or energy. Furthermore, because there is some 365 points that are located on major channels, you're going to get multiple benefits from certain points that are going to affect and correlate with different organs in the body. Another benefit to consider when dealing with ADHD would be brain exercises. Lots of crossword puzzles, jigsaw puzzles, playing cards, drawing, doodling, anything that kind of connects your mind into a focal point. Don't forget meditation. Also, listening to classical music while walking briskly can be beneficial. So, to sum up this presentation, alternative treatments for ADHD include elimination diets, supplementation with omega-3s and other minerals and vitamins discussed previously, exercise, yoga, meditation, neurofeedback, and memory training. In the description box below, I would like to include the medical doctor's paperwork, including the Feingold diet and other alternative treatments for ADHD, as well as a website you can visit that goes more in depth on the acupressure points so that you can see a visual that will better help understand what I'm trying to put into words. I hope you enjoyed this conversation and have a better understanding of what ADHD is, what the underlying causes could be, how to better help this situation for yourself or a loved one, and also some healing modalities that can be used in unison with taking a pharmaceutical or while trying to separate yourself from that pharmaceutical. Just remember to have grace with yourself, be patient, and be kind. I hope all are well, and I will talk with you guys soon. Thank you.